Hi everyone, I'm Dr. Madhumita and you all know me as MedicoMadhu. These days you must be noticing a lot of kids with skin issues. One such condition is atopic dermatitis, which is basically an allergic condition. Today I'm going to explain you what are the ways by which we can prevent this condition. So before going to the prevention part, let's first understand what this atopic dermatitis is all about. This is a skin condition which involves mainly the face area, that is the cheek. It can involve the neck region, it can involve the arms and the legs. There might be a mild itching, there might be a little bit of swelling, and it can recur as well. So, this basically can progress further to involve other organs. Like, for example, the child can have rhinitis, the child can develop a bit of allergic wheeze, or it can be an asthma as well. But this can be totally prevented. How do we identify it? Mainly by clinical symptoms. So, we diagnose this condition mainly by doing clinical examination. Clinically, the child will have a bit of itchy skin. There would be a little bit of dryness on the skin surface. There can be slight thickening and marking in the skin surface. The child might also have other features, like I mentioned before, could complain of pollen allergy or some food allergy, or the child might even tell us that he or she is having intolerance when he or she goes to the cold weather. Any of these things can help us in diagnosing the condition. And one more thing, the child, when he or she has a superadded infection on it, we might have to go for other blood investigation as well. In blood investigation, we might have a increased IgE level. We can have a CBC in which the eosinophils will be on the higher side. With superadded infection, we might do a swab of the skin, which can show us the bacteria that is there in it. So, how are we going to prevent this condition? This condition mainly needs only prevention. So, I would like you all to pay attention to this part. First is keep the skin hydrated. How are we going to hydrate it? By using moisturizer. After the child has a bath, do not rub the skin of the baby when you are drying it. Always dab dry the skin with a soft cotton towel. Second would be to give the baby a bath at least twice a day. Why did I use the word baby? Because it can start as early as infancy, but you don't have to worry about it per se. Simple measures can help you a lot. So when you give a bath, it should be only for about 10 to 15 minutes. It should be twice a day. This helps not only in cleansing the skin, but also in hydrating the skin. Whenever you give a bath, make sure that the temperature of the water is only lukewarm. It should neither be too cold, nor should it be hot. So make sure of these things. Water per se should not be hard. Hard water is itself as an independent risk factor for atopic dermatitis. Certain salts can be added to soften the water. That would be ideal. Soap that you use for the baby should be low fat, low lather forming soap. As much as possible, avoid any chemical products on your kid's skin surface. If you know any allergens in your house, or the baby himself or herself is complaining, Mama, when I take peanuts, I'm having a little bit of discomfort, this itching starts. Or he or she says, when I go out when it is windy, I'm developing it. Or during a cold weather, I'm developing it. Please start noting these things. It could be your pet for all that you know. So, if you are able to identify the risk factor, kindly avoid it as much as possible. If you're not able to identify the allergen, still it doesn't matter. Make sure that your upholsteries, your bedspreads, and your carpets, your whatever fomites that we touch and use on a regular basis is cleaned regularly. Vacuuming the house will help you. Washing the clothes would be helpful. And even your pets, when the kid is handling the pet, make sure that he or she is wearing a full arm or fully clothed. and wears a cloth gloves, and wears a socks, and wears a mask, goggles, and all these things whenever he or she is handling the pet. And make sure that your pet is not entering the bed of the baby, or whatever the baby touches frequently, your child touches frequently. You see through that the hair or even their droplets don't fall in any of these areas. This would actually help in preventing these skin rashes or skin condition from progressing further. If none of these are helping, make sure that the pet is staying away from the child. Apart from these simple measures, you should also maintain a diary to see as and when the kid's condition is exacerbating. This might help you in identifying the cause. Last but not the least is psychological factor of the baby. You might be very careful with your kid. You might be putting a mask when he or she is going out in a dusty environment. You might be providing the child with a humidifier, or you might be providing the child with a air purifier or hypoallergenic for washing their clothes. All these things you might be using, but you might have forgotten that their psychology is also equally important. Anytime your child is stressed about an exam, he or she is depressed about losing a friend who has traveled to some other city to study, all these things will definitely increase a skin allergy. So make sure that your baby is healthy and happy. Not just healthy. Healthy is not a word which is only for physical parameters, but also for emotional growth. So make sure that the baby is emotionally also happy. This will help in preventing the child from developing atopic dermatitis. Not just atopic dermatitis, but with allergies in general, whether it's rhinitis, conjunctivitis, or asthma. All these simple measures can help your baby. Treatment per se, we give them topical steroids, we give them moisturizers which are medicated. Apart from that, we also have PUVA A, PUVA B, we have other sorrelin therapies and PUFAs. We also give them immunomodulators, biologicals. The options are multiple, but when it can be prevented, let's just try and make it as much as possible with just simple measures. And if there is a need, definitely we are always there to help you all. Please bring your child to us. We will treat them. I'll meet you all with yet other videos which will be as informative as this one. Good day.